All right, let's dive into this. Intermittent fasting, or IF as most folks call it, seems like you've been really digging into this lately, huh? Especially all this research on how it could help prevent, like, the biggest health problems out there. We're talking heart disease, cancer, the whole shebang. So you sent over a whole stack of research articles, and, well, we're ready to unpack it all.
Yeah, it's definitely a hot topic, and for good reason. There's a ton of research coming out suggesting that IF could be way more than just some fad diet. Like, it might actually be like a real game changer for improving health.
So should we start with cardiovascular disease? I mean, that's still the number one killer globally, right? Any
Yep.
way to prevent that is definitely worth talking about. So what's the research say about IF and heart health?
Well, it's a little bit of a mixed bag, to be honest. Some studies show it's really effective for, like, short-term weight loss.
Yeah.
Definitely better than just eating whenever you feel like it. But when we're talking about the long-term stuff, the risk factors for heart disease, it gets a bit more complicated.
Okay, so not a magic bullet then. But I'm guessing there are still some interesting findings in all this research.
Absolutely. I mean, look at this study. This one found that there was really no significant difference between intermittent fasting and just plain old calorie restriction. At least not for improving those classic heart health markers. Basically, both approaches did pretty much the same thing.
Interesting. So maybe it's not so much about when you eat, but more about the total amount you're taking in.
Yeah, that's one way to look at it. But then you've got this other study here suggesting that any kind of fasting, not just IF, could be good for your heart, especially if you pair it with exercise.
Wait, so just taking breaks from eating, no matter what the schedule is, could actually help?
Yeah, I'm starting to see why this research seems so all over the place. We're still trying to put the puzzle together on how fasting in any form really affects the heart.
Exactly. And you got to remember, these studies, they're looking at different groups of people, different fasting routines, they're measuring different things. It makes comparing them directly, well, pretty tricky. Makes sense. So what's going on under the hood, so to speak? How could I actually be doing all this good stuff for the heart?
Well, there's some evidence that it can improve insulin sensitivity,
Yeah.
and that's key for keeping your blood sugar in check. And it could also reduce inflammation, which is a huge factor in so many chronic diseases, heart disease included.
So it's like IF is going after those root causes of heart problems before they even become a real issue.
Yeah, potentially. And there's also research showing that IF could change your lipid profile, meaning it could make your cholesterol levels look a whole lot better.
That's encouraging, for sure.
Yeah.
Anything else in the research about how IF might affect heart health?
One area that's still being studied is the gut microbiome. We know now that it plays a big role in overall health, especially heart health. And there are some early signs that IF could cause some good shifts in the gut microbiome. But we definitely need more research to figure out exactly how that all works.
Okay, so we're still learning about all the ways IF interacts with our bodies, but it seems like there's real potential for positive impact on heart health. And you know, it's interesting, the Mediterranean diet, the one that's always getting praised for being heart healthy.
Right, and it's fascinating because the Mediterranean diet, with its focus on whole foods and regular meal times, well, it often leads to periods of natural fasting. Just by the way it's set up, people who follow this way of eating might be getting some of the benefits of fasting without even realizing it.
That's a great point. I think we need to think more broadly about what fasting really is. It's not just about strict rules and deprivation. It's about, like, the natural rhythm of eating throughout the day. Okay, let's shift gears to another big one. Cancer. What's the research saying about IF's potential role in both preventing and treating cancer?
So the research on IF and cancer, it's still in the early stages, but there's some really promising findings popping up. Like some preclinical studies, the ones they do in labs with animals, show that intermittent fasting can actually slow down or even stop the growth of certain types of cancer. And the researchers think this might be because IF affects certain hormones related to, like, cell growth and metabolism.
Hold on, we're talking about messing with hormones. Isn't that a little risky?
It's definitely complex. Some hormones that get affected by IF, like insulin and IGF-1, are known to play a part in cancer development. So by influencing those hormones, IF might be creating an environment that's not so friendly to cancer cells.
So it's all about finding that balance, reducing cancer risk without messing up other important stuff your body needs to do.
Exactly. It's a delicate balance, for sure. And we need more research to really understand the long-term effects of IF on all these hormonal pathways. Because some of those hormones are important for longevity and overall health. It's not as simple as just shutting them down completely.
It sounds like we're just starting to understand how IF impacts these complicated processes in the body. What about research on IF specifically for cancer treatment? Anything promising there?
There is actually. One of the reviews you sent focuses on just that.
Hmm.
It highlights how IF might make cancer treatment more effective and even help with some of those nasty side effects of chemotherapy. For instance, it might improve glycemic control, get those liver enzyme levels down,
Yeah.
and that could potentially lower the risk of liver cancer.
Wow, that's incredible. So IF could play a role before and during cancer treatment.
That's what they're hoping for. But it's important to remember this is still a new area of research. There's a lot we don't know. But the idea that personalized diets like IF could be a key part of cancer care, that's pretty exciting.
Yeah, sounds like a promising area for future research on new treatment approaches. Okay, but we have to talk about this one. Unintentional injuries or, accidents. This one seems a bit harder to connect to IF. What have you found?
Yeah, you're right. The connection between IF and accidents isn't as obvious as it is with, say, heart disease or cancer. The research looking directly at IF and accident risk, it's still pretty limited.
Yeah.
But there could be some indirect effects we need to consider. Like some studies show that IF might improve how well your brain works, cognitive function and all that.
So, theoretically, could people who do IF make better decisions, react quicker, and be less likely to have accidents?
It's possible, yeah. But we need more research to really look into that specifically. On the other hand, some people get side effects from IF. Things like headaches, feeling tired, even dizzy, especially when they're just starting out. And those things, well, they could actually make someone less alert, and that could increase their risk of accidents, at least in the short term.
So, it's kind of a two-sided coin. Potential benefits for your brain, but also potential risks, depending on how your body reacts to IF.
Yeah, exactly. It's complicated, and it's different for everyone. It's not just about whether IF is good or bad for preventing accidents. It's about how different people respond to it and how that might affect their behavior, their decision-making in ways that could lead to accidents.
Definitely a fascinating area for future research. It seems like with IF, the more we dig in, the more questions we end up with. But that's what's so cool about science, right? Always pushing the limits of what we know.
Couldn't agree more. The more we learn about IF, the more we realize there's so much more to discover.